Just finished the subjective data collection, which I'm sure you guys are all pretty good with. And now I'm going to move into the objective data collection. I just washed my hands.
Student nurse assesses the right jugular vein.
All right. So before I do that, in objective, I'm going to look at my patient from head to toe. I'm going to look and see whether or not his skin color is nice and pink and warm. Again, you can do little things like assessing capillary fill. You could think about peripheral edema because we're talking about the heart, and that might be, if you've got congestive heart failure, high blood pressure, you could have swelling of the rings or swelling of the feet or the legs. And after that, then I'm going to hone in on the specifics, like that JPP. So what I'll do is I'll lay my patient flat. Mr. Gasp, is it okay if I lay flat?
Yep.
All right. And if there was a pillow behind his neck, I would take it out. And can you turn your head slightly that way for me? And come on in, take a peek. It's got a nice jugular vein. Every person, even a normal heart, will have jugular venous distension when you're lying flat. And it's normal to go away at what measurement?
35.
So comment on that. So Mr. Gass, I'm just going to raise the head of your bed now. And while you're raising it, be staring at that nice little fluttering jugular vein. And you're watching for it to disappear. Your patients, it may not disappear on. And if it doesn't, say it was here, you would grab your ruler and a tongue depressor and say, Mr. Gass, I'm just going to measure your neck, so just keep turned perfectly. Place it right over there, the angle of Louis, or the manubrium of the, yeah, right there. And you will put your stethoscope, sorry, not your stethoscope, your tongue depressor, where you think you see it, and line it up perpendicular with your ruler. So what's normal?
Less than 4.
Less than 4 centimeters. Okay, so 3 to 4 centimeters. Good. If it goes away, you can just say no jugular venous distension. If it's there, you would say jugular venous distension present, and then you would measure it. Okay. Moving on to assessing the carotids bilaterally. You're gonna again just turn your head that way. I'm looking to see the. There we go. And I'm going to auscultate with the bell of my stethoscope. And I'm going to auscultate in between breaths. So if you could take in a big breath, let it out, and hold your breath. And turn towards me. And same thing, big breath, let it out, and hold it. And you're assessing for bruits. Some textbooks say you need to listen to 3 places. For the sake of our learning, it's great that you're listening to 1. And if you hear a bruit, what don't you do? Palpate. So right now, because I didn't hear a bruit, I'm going to palpate. So I'm just going to press a little bit here. And the other side. Thank you. And noticing the quality and characteristics of his carotid arteries. What else was I just thinking right there? We'll comment on that, but I was thinking.
Symmetry. Strength.
Oh yeah, what I
material.
wanted to say is what you would never do. What would you never do?
Okay.
You would never palpate simultaneously the carotids. That's an absolute wrong, bad, don't do it.